Hello everyone, welcome to my channel. In this video, I'm going to talk about homeopathic medicine for diarrhea. Myself, Dr. Megha from Yogic Homeo Science. You may be really kind of looking out for the homeopathic medicine for diarrhea. Alosacotina is one of the fantastic remedy. The common name of Alosacotina is Sacotina aloes. It is one of the fantastic remedy which is used for the diarrhea, constipation, and dysentery. So Naxomica is also one of the remedy which we use for all these three, but Alosacatina also plays a fantastic role, and it helps in the treatment of diarrhea so much. So today's will be all about Alosacotina. Before moving to the diarrhea symptoms of Alosacotina, we will be talking about the keynotes. Whereas it was one of the means Nash the Chaudhary, who is a philosopher of homeopathy, has said that to write a Metra Medica without a loss is to write a novel without a hero. He says like that because Alosacotina is one of the Whereas the Alosacotina is one of the really goodest and finest remedy for everyone, not only for diarrhea, for dysentery, for the constipation also. So let's move on to the constitution, how they will be looking, how the physical look of the Alosacotina people will be, especially suited to the old people, women of relaxed or have this kind of habit, whereas very persons leading sedentary life, whereas physical and mental labor is also kind of aggravation for the Alosacotina patient. Moving on to the things, Alosacotina is hot patient, and they are really kind of cannot tolerate any kind of warmth. They always crave for the cold things. Moving on to the keynotes, guiding symptoms, profuse jelly-like mucus from all the mucous membrane, especially of intestine and the throat. Insecurity of rectum with want of confidence and power in the sphincter ani. Hot patient, aggravation from warmth and emulsion from cold water and cold weather. I had already said that everything for them should be cold because they crave for that and they really want the cold things and cold weather, cold water, and everything. It appears each year as winter appears. That is the specific symptom of the Alosacotina, and dissatisfied and angry about himself or his complaints, especially when constipated. Hemorrhoid like bunch of grapes. I'll be talking about the hemorrhoids, means the piles, also in the next video about Alosacotina. Homeopathic medicine for piles. I'll be talking about Alosacotina only. Of course, I have so much of remedies also for the piles, but I'll be covering up one remedy for all the indicated diseases. Later on, I'll be covering up the later. So diarrhea is followed by obstinate constipation. That is one of the peculiar symptoms. Solid stool passes out involuntarily. So the liquid stool is not passing out involuntarily. Here you should keep your little bit of confidence. Solid stool passes out involuntarily. Okay, moving on to the diarrhea. Causation. How this causation is after eating and after drinking. The patient after eating or after drinking, he wants to go and pass the stool. When is the time? Early in the morning, the patient has to hurry to the closet, driving out of bed. Early in the morning or immediately after eating and drinking. The patient cannot control his motion, so he always makes sure that wherever he goes, there is a bathroom. So he does not even have the confidence that he can control it. Where he always feel like I want the confidence in my sphincter ani, but the confidence is not even given to him in even after taking the medicine. So that kind of insecurity is there for him of the rectum. Always wants the confidence and power in the sphincter ani. how much the quantity is squanty squanty stool. Every time they always feel like, okay, I did not pass much, I passed only a little bit of it. So what is the character of the stool? Watery yellowish jelly like mucus in the stool, and it is also kind of painful. Before the stool, the abdomen is distended with the gas, causing a feeling of fullness and tightness with rumbling and giggling sound in the abdomen. So this is the abdomen before the stool. The abdomen is distended with the gas, causing a feeling of fullness and tightness and rumbling and gurgling sound in the abdomen, with sudden urging and heaviness in the rectum. During stool. During stool, what happens? Cutting and gripping pain in the right lower portion of abdomen, excruciating type of pain with much flutus. When passing flutus, sensation as if stool could also pass with it. This is the feeling of the allosocotina patient during the stool. Sensation as if stool could also pass with the gas. The flutus is very offensive, burning and copious. Much flutus with a small quantity of stool. Burning in the anus after passage of flutus. Also during stool, there is gushing of thin, yellowish, watery, offensive and excoriating feces, which burns like an fire, making the anus sore, hungry during the stool. After the stool, what happened? All the pain ceases after stool, leaving profuse sweating and profuse weakness. So this is all about the diarrhea of allosacotina. During stool, before stool, after stool, you'll come to know the difference. So the diarrhea, allosacotina is also kind of indicated in the dysentery and the constipation. One of the concomitant symptoms of allosacotina diarrhea is diarrhea always alternates with the headache. So the headache is also one of the causative factor for the diarrhea. The headache causation is due inefficient stool and from a sedentary life. Headache is always seen in the forehead. Congestive type of headache, congestion and fullness is seen, aching pain above the forehead and with heaviness in the eyes and must close them. So this is the thing which is happening with the allosacotina. Whereas moving on to the general modalities of allosacotina, when the patient will be feeling worst and when the patient will be feeling better. When they are feeling better is early in the morning, sedentary life, hot dry weather because they are hot patient, after eating and after drinking, and standing and or by walking. Amelioration by cold water, cold weather, discharge of fluids and the stool. This is one of the peculiar symptoms of the allosacotina. Allosacotina is so much closer towards the sulfur, so sulfur can even antidote sulfur also area constipation and the dysentery just like the allosacotina. But both plays a very close kind of relationship when it comes to the prescription. But sulfur patient is also an odd patient, but it does not run to the restroom after eating and drinking. Early morning, of course, he will be like that, but allosacotina patient is very much more like that. Okay, I'll be ending my video about homeopathic medicine for diarrhea, allosacotina. I think this video was helpful. Thank you for watching. Please do like and subscribe.